Hello, I'm Natalie Michaels, editor of Tulsa Kids Magazine. We have partnered with St. Francis Children's Hospital to bring you important health information for your family. You can find all our interviews on our website and in our magazine. Just look for the PJ's Corner logo, and you'll find that online and in our print edition. Joining us today is Dr. Brandon Woods, a pediatric critical care doctor. He attended medical school at the University of Texas, San Antonio. He served his fellowship at the University of Washington Medical Center and the Seattle Children's Hospital. And he was in practice at the Madigan Army Medical Center in Seattle before coming to St. Francis Children's Hospital. Today, Dr. Woods will be talking to us about tick-borne illnesses. Welcome, Dr. Woods.
Thank you for having me, Natalie.
You know, I hear more and more people talking about tick-borne illnesses. Feels like more now than ever. Is that just me, or are they becoming more common?
Yes, we have seen an increase in the amount of emergency room visits or urgent care visits, as well as a handful of kids getting admitted to our hospital with tick-borne illnesses. And that's primarily due to the life cycle and the changes we've seen in our having a milder winter, as well as a rainier spring. Remember last winter is pretty mild, followed by the April and May showers that kind of led to having an increase in tick prevalence in the summer time frame, the early summer. May through July is kind of the time of the year where we see a lot of tick bites. And so the more exposure we have during those time periods, the more bites we get, and then the sequelae and illnesses that come from that. So yeah, past few years, we've had every time we have a milder winter like we're having now, we maybe see an increase in tick-borne illnesses.
Well, that makes sense. Could you tell me about what some of those illnesses are, how they present themselves?
Sure. There are three or four very common ticks that we see here in Oklahoma. The Lone Star tick, it has the characteristic white dot on the back. If you think of like the Texas flag, how it has a single star in it, so maybe the Lone Star tick, the American dog tick, and then the deer tick are the several of the most commons. Those ticks live around 2 to 3 years, and they have a specific life cycle. They hang out in tall brush, grassy areas, and then they jump onto the host, us humans, and then their bite, if they stay attached to us, they do a blood exchange and actually give us some illnesses if they're on for several hours for a longer period of time. So some of the common illnesses that we see from tick bites here in Oklahoma are Rocky Mountain spotted fever, ehrlichiosis or anaplasmosis. Very rare, we can see an illness called tularemia, and then Lyme disease, as well as alpha-gal syndrome, which is, I can talk a little bit more about that later, but it's an allergic reaction that you develop specifically to the alpha-gal sugar molecule that gives you difficulty time when you eat red meats or mammalian meats. You can develop an allergic type of reaction. The other Rocky Mountain spotted fever and ehrlichiosis, those are more bacterial infections that you can get, and they're commonly treated with antibiotics. Lyme disease as well, we can test for Lyme disease, and has a unique kind of characteristic rash that's sometimes prevalent in other things too. So those are some of the common diseases that we see. Thankfully, only less than 5% of ticks carry these type of bacteria within their bloodstream that can actually transmit it to humans. So thankfully, these are very rare diseases that we don't see too often, but we have to think about whenever we're having a kid come in with specific symptoms.
I know parents wonder and worry about when they should bring their child in. Um, what could you tell parents about that? Or should they wait for a sign? Should they look at the tick?
Yeah, and I think a lot of it has to do with prevention and knowing whether you've been exposed to a tick. So say you find a tick after doing some hiking, it's best just to document the, keep in your mind when that tick bite was, and the symptoms can develop several days to weeks afterwards. So it's good to do some preventive measures up front, which I can talk about later, but also like keeping a good diary of symptoms. So the typical symptoms that we see after tick-borne illness are very non-specific. So children may develop a fever. Okay, there are a lot of different causes for fever. They may develop some muscle pain, some joint pain, some aches. Those are all very non-specific. But sometimes we do see a development of a rash, and it kind of looks like a bullseye or target that rash that you can see, and usually a week plus out from the actual tick bite exposure. So doing the normal things we do at home for fever and general malaise and not feeling well, but knowing when you had that tick-borne exposure might help us narrow the diagnosis down, and seeing your provider within the development of symptoms of rash, fever, malaise, etc.
Is it helpful to bring the tick in if you've saved it in a bag or something?
Either that or in the digital era, we can take a picture and a photo. We can, match the specific type of tick that we think it is. That certainly helps us narrow what disease process we think is going on. And there are ticks can carry we can match the tick with the type of illness that we think, and based on some other blood studies that we can draw from our patients, it helps us narrow down the diagnosis.
Can you talk to us about how the diseases are treated? And it sounds like you mentioned alpha gal earlier. That's one that I feel like I do hear more and more about. Are some more complicated to treat than others?
Yeah, some require antibiotics, so such as Rocky Mountain spite and fever. That's more of a bacterial infection, as well as ehrlichiosis or anaplasmosis. Tularemia is also a specific bacteria that gets transmitted. So all those usually require antibiotics to run their course and treat the illness. Now, there's when you talk about Lyme disease and then possible the southern tick associated rash illness. So those are very two closely related illnesses. The starry or southern tick associated rash illness mimics Lyme disease, except you only basically have primarily the rash and it goes away, and you don't actually have the blood tests that we check you for having Lyme disease. So those are it's more of a milder case, and it runs its course, and you don't have the multi-organ effects that you do with Lyme disease. Now, when you talked about alpha-gal syndrome, that's more of an allergic reaction that your body can develop because of the antibodies, et cetera, that you develop from the tick bite. And so you have a difficulty eating red meat, mammalian meat. So several hours after you consume meat products, you develop the typical allergic reaction that we see, based on similar to other food allergies. So we treat it the same way as if it's a food allergy. And we also, that's another diagnosis that we get our help from the allergist immunologist to kind of help manage, but that can take several months to years to actually go away after this tick-borne tick bite, excuse me. So thankfully that's pretty rare, and it's something that we kind of have to exclude other diagnoses before we give you that one. But it's something we keep in mind. We have a kid coming in with an allergic reaction that we don't know what the cause.
Are children more at risk or more susceptible to any of these particular illnesses?
Um, uh, Basically, they're prone because of their height, etc., being lower to the ground and being playing in brush and tall grass. Yeah, they have a little bit more risk with exposure, and so from that, they're high risk for getting the illnesses. And then, a typical any age kid gets several viruses per year, so we have to tease out the symptoms of fever, malaise, joint pain, other symptoms to actually be thinking about a tick-borne illness at the same time. So it's a little bit harder to tease out what their true illness is. Therefore, seeing your pediatrician will always help.
Right. You had mentioned earlier about perhaps some practical steps that parents could understand to help prevent tick bites.
Yeah, well, I think preventing exposure is the best thing you can do for it. So starting with keeping keeping the child covered as best you can. So long sleeve shirts, long sleeve pants, even tucking your socks in. I know it's a great, cool look, but tucking your pants into your socks will mitigate the exposure, especially when you're knowing that you're going to be out doing hiking or in area prevalent with ticks. Certain things, once you do, you can also use permethrin on your clothes. That also helps reduce exposure, as well as using tick spray that can mitigate the exposure. And then certainly things that you can do when you get home, knowing that you're going to go hiking in the woods. First thing is to take off your clothes, and then if you want to throw them in the dryer on high for 10 minutes, that also gets rid of the ticks, as well as doing a very thorough tick check. So ticks like to hide in kind of darker areas and crevices in our skin. So the groin area, the buttocks region, the between our toes, that sort of hands, etc. Those are places to do. And I recommend all parents do a tick check as soon as they get home and then the following morning. So the tick staying attached to the child for hours to the days is what really gives them a higher risk of developing tick-borne illness. So if you're able to check them immediately once getting home from a hike, and then again in the next morning, taking a bath right away also limits exposure and gets rid of any ticks that may have jumped on momentarily. And those are some very common practices that definitely help mitigate your risk and exposure to getting a tick bite.
I know some parents worry about when they see the tick, do they just pull it? Is there a way to use alcohol, or is there a good way to take it out?
So the best method that we recommend is using tweezers, and not to do any twisting motion, but to grab tweezers, they're not really the head, but the mouth portion of the tick and pull straight up. The twisting motion can cause dislodgement of some of the teeth and the mouth apparatus that the tick uses to exchange blood with the patient. So doing a clean swoop, pulling straight up, and that helps remove the tick completely. You want to wash your hands, wash the soap with soap and water on the exposed site, as well as your hands, if you're the one pulling the tick out of your child. Um, and then you kind of want to note the date and time of when you removed it, so that way you can just be monitoring for those symptoms to develop, sometimes days to weeks later. So storing it in your phone and saying, hey, yeah, Johnny was exposed with the tick, on this date, and I pulled it,
Mhm.
developed symptoms a few days later. That helps us really narrow down what type of illness they may have.
Are there any common myths or misunderstandings about tick-borne illnesses?
I would say what we see most commonly is someone gets bitten by a tick and they immediately want to jump to like Lyme disease, or come in and immediately think that their child has a long debilitating condition. But a lot of it is just watchful waiting. And, we have several blood tests that we can do, but sometimes those take days to weeks to return, as well as they won't turn positive for days or weeks. So kind of careful vigilance and watchful waiting, treating the child normally until they develop those symptoms of fever, rash, joint pain, malaise, and watching for that characteristic bullseye kind of pattern on the rash. So you don't have to come in immediately unless you're concerned about like developing a skin infection. But if you just pull the tick, just monitor and note the time and date that you were able to remove the tick, and kind of be watchful waiting for those symptoms to develop.
Well, it will, I know we're in winter now, but you mentioned that it will be spring before we know it. And I know people really will be appreciative of these tips. So thank you very much, Dr. Woods.
Yeah, early May through July are the time frame that we typically see a lot of these. And these are quite rare occurrences. And so just doing your best to keep kids covered, and doing those tick checks as soon as you get home from a hike.
Very good to know. Thank you so much.
Okay, thank you for that.